Hello, my name is Lydia Bartholow. I am a psychiatric nurse practitioner from Portland. Prior to becoming a psychiatric nurse practitioner, I practiced herbal medicine for many years. So I do my best to combine those two modalities. These days, I primarily work with extra vulnerable folks, folks who are homeless, folks who are unstably housed, and I provide addiction medicine. So I work at a place in Portland called Central City Concern, and I, for the last several years, have acted as the medical director of all of our outpatient substance use disorder services. All right, so let's go ahead and get started. Part one is really an overview of sort of how we understand addiction, how we think about it culturally, and how some of our ideas over time have shifted about what addiction is. So spend some time with that, and then we're going to actually carry thinking about the values and why you do the work that you do. And then I want you to also kind of keep in the back of your mind these cultural narratives about what causes addiction and who addicts are. And I want you to just think about that as we then pivot and talk a little bit about trauma. And one thing that I want to highlight here is that this idea of hypercortisolemia affecting health outcomes, which is this slide, health outcomes, so stressors affecting health outcomes, it's actually such a big deal that we talk about it a lot in public health. Thinking about the notion of allostatic load. So allostatic load is essentially how burdensome cortisol or stress is for your health outcomes. And what we're going to focus on next is how we think those two things are connected. And then we're going to pull in the neurobiology that we just talked about around trauma and stress. So we know, and the public health literature is very clear. We know that adverse childhood experiences really increases adoption of health risk behaviors. So just go back for a second, thinking about this number, 4,600% increase, which means 46 times more likely. So that was just a quick highlight on how ASAM has shifted to be more trauma informed and to understand the way that trauma influences people's experience of substance use disorders. And then I just want to focus on this one last thing before we wrap up. You may have noticed that I was pretty careful in the words that I picked. So one of the first things that we can do in being trauma informed, and also to help us remember to sort of change our paradigm and how we think about what causes substance use disorders and who people that struggle with addiction are, is to just change our language.